Professor Dale Fisher is here. He's a senior consultant at NUH's Division of Infectious Diseases. New protocols are one thing, Prof, but an asymptomatic case, if worried or afraid, would still want to seek medical help. So how far would this new set of rules go in alleviating the burden on our healthcare workers?
Thanks, Olivia. The new protocols should help, but they haven't really flowed through yet. The main point for the public and someone who is diagnosed as asymptomatic infection is that they shouldn't be fearful. The new guidelines, if followed, I believe are incredibly safe. The data is very clear, and that is that we have a new situation post-vaccination. In this post-vaccination era, if you are vaccinated and you don't have risk factors or elderly, then the disease is very safe, and particularly if you're asymptomatic. So these new rules that have been put in place, or new guidelines, they haven't flowed through to hospitals yet, because if you look at the data, there's yesterday there were about 40 people on ventilators. There were 300 not on ventilators but requiring oxygen. But altogether there were about 1,300 in hospitals. So this means that about 1,000 people in hospitals didn't actually need any specific care. And of course, about 2/3 of those that did require the care are unvaccinated. So this unvaccinated part of the community is still being very demanding on hospital services. So I think the community needs to have confidence and work with us in this. If you're ART positive and you're well, then stay home. If you're concerned, there's more options for telemedicine coming up through primary care. They're being established now, I believe. But if you do become unwell, then go to your GP, and if you have a PCR positive test, then you'll be streamed into one of three pathways: the CTF, the community facilities. Then there's home recovery. And occasionally some people, particularly if they've got risk factors, will be referred to hospital. So I think there'll be some teething problems as we get through all these, but we really have to create an environment where the hospital's not full of people that are afraid when they don't need to be.
Right. Well, it has been a few weeks since the home recovery program started, but has the burden on hospitals been eased? What is the current situation in hospitals right now, Prof?
Yeah, hospitals are very stressed, Olivia. As you probably know, that there's large, probably most elective surgery has been postponed. Many staff have been redeployed in other areas, particularly to care for COVID cases. A lot of the wards have actually been completely repurposed just to look after COVID patients and isolate them, because we're trying to keep the hospitals at COVID zero transmission. All staff are getting tested, probably twice a week, unable to have holidays. So it is very stressful for hospital staff, but all healthcare workers really, paramedics and nursing home staff. Everyone's feeling the pinch. And the public really can help us a lot by actually just following the government guidelines and not coming to hospital if they're not sick. But I'd also ask if you could have some sympathy for hospital staff when they're enforcing no visitor rules or testing, and if the doctor in hospital says you can go home, then please go home and free up the bed, because we've had so much experience with this disease now. It's I think you can be very confident in the decisions being made. There's a lot of telemedicine happening as well, which can also help people not come to hospital. And also, obviously, the public can also help in getting their loved ones vaccinated if they're not vaccinated.